Cast care advice. To help your injury heal properly, we have immobilized your injured body part with a cast. You may feel some discomfort, but please bear with it so that you can recover as soon as possible. It is important to take care of your cast to reduce complications such as ulcers and blisters. Here are some do's and do nots to take note of. Keep the casted limb elevated to reduce swelling. Elevate the affected limb on pillows above the heart level to reduce the risk of swelling. Applying arm sling. For casts above the elbow region, ply the arm sling so that the arm is at a 90-degree angle. For casts below the elbow region, ply the arm sling so that the arm is at a 45-degree angle. Make sure to avoid any pressure on areas, such as the elbow or the heel of the foot. Place a rolled towel below the ankle to offload the heel. When in a seated position, keep your leg elevated as well. Next, wriggle your fingers or toes regularly to maintain blood circulation. Next, always keep the cast dry, as water can affect the integrity of the skin and cast. Use a plastic bag to wrap the cast, taping the ends to make sure there is a tight seal before you take a shower. Make sure it is not too tight to prevent swelling. Moving on to do nots. Do not damage your cast with sharp objects, or remove any part of the cast without permission from the doctor. Next, do not apply pressure on the heel of the foot or put your weight on the casted limb, as you may suffer pressure ulcers and risk injuring yourself further. Next, do not get the cast wet, as it may damage the skin and cast integrity. Next, do not scratch any itch under the cast with any tools. Use a hair dryer on the cool setting if the itch becomes too unbearable. Signs and symptoms of complications. Return to the emergency department if these signs and symptoms are present. Cracks in your cast. Cast is wet. Cast is loose. Worsening pain. Worsening swelling. Worsening numbness. Worsening bruises, discoloration. And foul-smelling discharge. If you are a patient in the ward, please follow the instructions of the nurses and highlight if you encounter any of the complications mentioned during your stay. Thank you for watching this video. We wish you a speedy recovery.